Heart failure, that dilated ventricles. There are a lot of reasons why a heart can fail. Heart can fail after a heart attack. There can be electrical problems. Patients with hypertrophic obstructive cardiomyopathies, HOCM, in those patients, the heart can fail. Valvular heart disease, if untreated, patients with severe aortic stenosis, severe mitral valve involvement, the heart can. The causes of heart failure, it can be a genetic problem. Many times, the main reason, the cardiomyopathies which we discussed, it runs in families. If you have a family history of heart failure, or somebody has a family history of sudden death in the family, those patients, the family should be screened of any possible heart defects, or cardiomyopathies, hypertrophic obstructive cardiomyopathy. The family members should be screened, because this disease can run in families. Even coronary artery disease is such a common disease. Genetics it's one of the factors which can really affect the blockages, how fast the disease happens. There's so many causes of coronary artery disease, but genetics plays a huge role. If you have a family history of bypass surgery has been done, grandfather or father was operated, you should be careful, because there are things which are under our control, there are things which are not under our control. For example, how much cholesterol we take, what kind of a diet we take, do we smoke, do we control the hypertension, diabetes mellitus. All these things are under our control. But if you have bad genes, unfortunately, if there is family history of heart disease, these are some of the things which are not in our control. So we can control those factors. There are certain factors which we can modify, the diet, exercise, diabetes control, cholesterol control, those things that we can do. But advancing age, as the age advances, or if you have a family history, and male gender, these are the risk factors for coronary artery disease. So coming back to the heart failure, genetics, obesity, inactivity, not doing much exercise, high blood pressure is one of the causes of heart failure. Because if you have a high blood pressure, many patients think that I'll just try to control it with diet or exercise. Lekin, we should understand that if the blood pressure is not controlled, every time the heart beats, it is beating against that much higher pressure. Somebody has a normal pressure of 110/70, then the heart is relaxed. But if the blood pressure is 200 systolic, the upper blood pressure, then the heart has to beat harder. It has to work very hard. Then other causes of heart failure: smoking, coronary artery disease, heart attacks. Heart can fail. Coming to the symptoms of the heart failure, patient can have dizziness, tiredness, history, symptoms of fatigue, shortness of breath, can't walk much, climbing stairs can be a problem. Everybody gets short of breath when you climb stairs, but unusual, than what is expected is not a good sign. You should see a doctor. Having palpitation, conscious awareness about one's heartbeat. You can feel that your heart, is beating, or maybe an irregular heartbeat. Those are some of the symptoms of heart. Patients can faint. Those are terminal stages of heart failure.
Subscribe now and press the bell icon. Never miss an update.